Welcome back to Advancing Healthcare Through Simulation. I'm your host, Lisa George. On today's episode, we're taking a behind-the-scenes look at a large-scale simulation through the lens of the simulation technologist, those who quite literally bring these complex learning environments to life. I'm pleased to welcome my colleagues from NAIT's Centre for Advanced Medical Simulation, Tom Waring and Bree Weyland. Tom Waring is a certified healthcare operations specialist working as the lead simulation technologist at NAIT Centre for Advanced Medical Simulation, where he supports and designs simulation-based education across health disciplines. He has over a decade of experience in healthcare simulation and was part of the team that recently delivered this Mass Casualty Incident simulation that we're talking about today. Joining him is Bree Weyland, a simulation technical assistant who's been at NAIT for a little over a year. As a SimTech, she's involved in scene setup, moulage application, and simulation planning and development. She is currently a student in the disaster and emergency management at NAIT, and she comes from a field adjacent to healthcare in personal fitness training, as well as a background in biohazard safety procedures in body modification. She's always been interested in how simulation can benefit students prior to stepping out into the real-world job experience. To frame today's conversation, we'll be reflecting on the Mass Casualty Incident simulation, which we held at NAIT on March 28th this year. This large-scale interprofessional event brought together more than 115 post-secondary students from health-related programs across Alberta. The scenario centered on a realistic building collapse requiring coordinated, person-centered care across the full continuum of emergency response. Learners engaged in dynamic role-based collaboration, from paramedic students working alongside firefighters at the scene to triage, treat, and transport these patients, then transferring them to one of two simulated hospital environments, a rural site and a tertiary care center, where interprofessional teams included students from medicine, nursing, respiratory therapy, diagnostic imaging, MRI, and laboratory programs, where they worked together to manage and care for 25 patients. Okay, with that background, let's dive right in. I'll start with you, Tom. You were working from a vision set by a steering committee. How did you take the high-level direction and actually bring it to life in the simulation environment?
For sure. So being part of the steering committee in the first place, as a simulation technologist, I was able to support and guide the steering committee towards something that was practical and achievable, and that had a huge impact on the final outcome of the simulation. I was also able to answer some of those early stage questions and create those ideas. Like, one of them was some crazy ideas like having a secondary rural hospital, or actually having ambulances be able to transport learners around the simulation. So having that input early on set the stage for what's possible later on.
That's fantastic. And I can say that, finding time to bring together all of these disciplines, either within NAIT or external, from the steering committee side of things, it's limited time, right? And it's such a large scale simulation. I know on the SimTech side of things, you need lots of time to develop and build those things as well. So I'm sure it was helpful from that standpoint.
Hugely, yeah. We started the development of this back in kind of November, December sort of time. But having that vision early on enabled us as the SimTechs to kind of build those ideas in the background and start fleshing out what that could actually look like before that full vision was created. Mm-hmm. On top of that, I'd say that this was by no means a small team effort. Crafting this was a completely collaborative experience. We had over 30 people involved in the actual sim development, and we would come up with an idea and pitch it back to the steering committee, or reach out to specific professions if we had an idea that was specific to MRI, let's say. We needed someone that was a subject matter expert in that field to have input on how that scenario fleshed out.
Yeah, absolutely. And so once that foundation was set, Bree, how did you approach character development? I know you played a large part in that. I'm curious on your process for building out the patient histories, the storylines, to really support the immersion and clinical decision-making.
The first thing that we consider when we're designing characters is really the objectives of the sim. So we wanted to make sure that we were really focusing on that. And the main goal of this MCI was, at the end of the day, their communication between peers. So we wanted to add in, compared to last year, some psychological disorders that weren't present last year, because that can challenge communication a lot for the students if it's something they've never encountered in the field, or they may need some support from another teammate. So we kind of began by taking the characters we had from a previous year and adding in neurological disorders and going from there. And we made sure to consult with subject matter experts when we did this, those who actually had practice in the field, as opposed to us SimTechs who a lot of the time haven't, and making sure that it was accurate, while trying to also rein it in and make sure it's something that the students could attain as well. When it came to actual just like character names and their careers and their outfits, which don't have much impact on communication, but really just make it a bit more realistic. So those kind of aspects, we used an in-house tool that Tom created called Simba. So it's an AI chatbot where we can input tons of different best practice simulation sources, and we use that to help us flesh out some of the characters.
I feel like that could be a whole episode on its own. I'm really excited to hear more about that. But I want to go back a little bit to the standardized patients or participants that were involved. There were a large number of them, 17, I believe. How did you prepare them all to align everyone so the experience was consistent between both offerings that day? And, also thinking about what you said about the backgrounds and history, I'm sure there were lots of questions.
Yeah, this was personally, I think, one of the biggest groups that I've worked with SPs. So I'm not going to say like everything went perfect. No sim day is. But we had 17 SPs come in, and some of them were ones that we had encountered before, which always helps that you see a friendly face. And then some of them, they had never done sim before, which was shocking that this was one of their bookings, but it happens. So we offered an optional Teams meeting to them prior to the simulation, which we don't typically do. So they were allowed to come and chat with us and ask character questions if they had it. If they wanted to ask more motivations behind why they were acting a certain way, that was an option for them to chat with us. So we had a couple show up for that, as well as we provided our personal CAM's email to them so they could reach out if they had questions. While a lot didn't take us up on that offer, we prepped as much as we could on the back side of it and made little cheat sheets for them. So when they arrived day of, we could hand them tiny pieces of paper where if they genuinely had no time to go through the script, they could read this cheat sheet and understand the character they were to portray that day.
Yeah, I really love that idea, especially because a lot of the characters had connecting pieces, right, to each other, and giving that time and opportunity to chat about it while other people can hear those questions that come forward, I'm sure really contributed to a successful experience for them and the students, right?
Yeah, it's awesome when we have repeating SPs, especially because a lot of them were familiar with each other as well. So they immediately started figuring out what those dynamics were within the group, because we had some people who were in romantic relationships. We had a mother and a daughter. There's a couple different dynamics that we built in throughout, and we did it purposely so that in previous mass casualties, we've just had everyone be one-offs, and it just adds to the realism of it.
Yeah, absolutely. Well, that's a great segue, talking about the realism. A huge part of that is the moulage, or the makeup that goes into that. So with 17 different people, I'm sure they all needed moulage as a part of that. What was your process, and how detailed did you go into designing the injuries?
We wanted to make sure we weren't going too crazy with the injuries, because sometimes we get more excited, me especially, and you have to kind of rein yourself in and go back again to the goal of the sim. So honestly, I would have preferred to have, if I could have all the time in the world with an SP to do moulage, that would be my goal at the end of the day, but that's not how it pans out when you have a limited amount of time. So we prepped as much as possible for that as well. We pre-make our silicone wounds in-house, so we made sure we did the inventory for that and double-checked it and triple-checked it. And then we always make a moulage schedule for our large scale events. So we have a group of SimTechs and we'll each get ideally 5 or less SPs assigned to us, and they'll vary in injury. So we try and balance who has large scale injuries and small scale so that we even it out. And then you know who you're responsible for that day, including getting their accessories, including their clothing, touch-ups in between the sim. So really assigning that in advance and trying to make sure you have the moulage prepped as much as you can before the day of the sim.
Mm-hmm. Yeah, a lot of preparation going into that. I can see that. So as the simulation gets started, that behind the scenes, what did communication look like for the team during the event? How did you keep everything running, especially with the setup of this simulation specifically being so, spread out through the entire center and beyond, out onto the street and the ambulances, that kind of thing? How can you stay connected as a team?
So the key stakeholders all had radios. So the SimTechs had a specific channel that we communicated with each other on, so we could support each other in whatever we needed. Throughout the simulation, most of our SimTechs were controlling mannequins. I was able to float between everyone else and kind of pick up the pieces as and when needed. As well, we had separate channels for EMS, so we could communicate with EMS on whatever they needed on scene. Mm-hmm. We also communicated with you considerably throughout the sim to keep everything on track. We plan for everything to go according to plan, but that's never how something of this scale is going to go. So we had to act on the fly hundreds of times throughout that simulation just to keep the flow moving and to keep on schedule and keep the learning objectives at the heart.
Yeah, absolutely. I feel like that's the key, right? We're bringing the students in to practice their communication, but also we need to model it ourselves and make sure that things are running seamlessly. Checking in at the halfway point, I think, was critical as well from my perspective, like on the facilitator side of things, but also seeing, what needs to be restocked. Could you tell me a little bit about that? Like how it was a short time, I think, between the morning run and the second one and trying to sneak in some lunch.
It was a pretty short time. I think we were very intentional around the character design, some of the moulage requirements and some of the mannequin reset elements of the sim, knowing that we had such a short amount of time to reset the entire simulation back to stage 1 again. Mm-hmm. So being intentional in the design in the first place played a huge part on that.
What's nice about a mass casualty is if they just get dirty the first round, it really just adds to the second round. So
very true. Yes. So a lot of intention into that design. And I can see, it really comes back to that first question about being involved right from the start. Absolutely. Because I think as a facilitator, those are things that I would not consider, right?
Another thing I think was super valuable from a facilitator standpoint was the physical presence of the SimTech team. We all wore matching t-shirts, so we were very obvious and stood out to everybody.
Yes.
And being physically present, we had questions all over the place throughout that we couldn't have prepared for. So having that physical presence made a huge impact for them.
Yeah, and especially important as we had people outside of our organization that were just orientating themselves to the space and wouldn't necessarily know the people. So that was a great, helpful point there, I can say. It really stood out on the photos as well. So with something this complex, I imagine, like you mentioned, not everything always goes as according to planned. What were some of the challenges and maybe lessons learned for next year?
I'd say one of my biggest struggles personally was managing the larger group of SPs, just because it was a first-time experience, and just everyone has different personalities, and it's like working on a team for the first time when it's super important the first day, so it's never going to go well, or go perfect, I should say. We did have a separate classroom for them to put their belongings in, so I feel like we planned very well for everything, but there's always going to be stuff that comes up. So just making sure that we nailed our time management would be something that I want to make sure we focus on for next year.
Yeah, that's a great point.
I think throughout the sim, we had engineered each individual patient's pathway down to an absolute T. After about 5 minutes of the sim, everything just went out the window when it regards to those patient pathways. So I think having to adapt on the fly, I think it actually enhanced the sim, because it gave the learners more opportunity to deal with the chaos. So we had things like patient bands already created for certain patients to go to a specific hospital. As soon as a patient turns up at a different hospital, you kind of just have to go with the fly and work with what you've got. And that's how the teams worked. It was really cool to see how they adapted to these changing environments.
Definitely. I think like you said, you can pre-plan. We had patient charts set out in both areas, but had we filled them out for each patient that we had intentionally thought would show up there, when they came to the opposite location, wouldn't have been prepared. So, there was a little bit of flexibility there, which I think was a benefit, and still being able to connect with the entire team really spoke to the success of the adaptability there. So Tom, from your perspective, what moments really stood out in terms of student learning or impact, would you say?
When it comes to role clarity and respect for other roles and professions, that was huge to see. A lot of the times, this is the first time the students at NAIT are actually interacting with nurses and doctors for the first time. So seeing how they work together as a team, they definitely started as a group of 60 individuals that didn't really know each other. But by the end of the 90 minutes, you could see them functioning as a really competent team, which was really cool to see for me. Seeing some of the coaching from the plants that were in the simulation. So we had like Strathcona and Fire there, and seeing them work with the paramedic students on moving and handling patients to extract them from the scene. I know the students got a ton from that experience.
Yeah, definitely. I think it just bridges that gap even more, right? From what simulation already provides before they head out into their clinical training experience. Anything from your side, Bree?
It was really interesting to see students step up into a leadership role that I think they themselves didn't even realize was happening.
Yeah.
But observing in some of the larger theaters that were meant to be the emergency areas, I saw a nursing student walk in and ask, like, who's in charge here? Who can I talk to about bed space or bed bays? And nobody responded. So she was like, okay, well, I guess I'll do it then. And really seeing them step up when the time called for it.
Yeah, nice. I know a lot, with such a wide setting of this scene, technical components come down to this, right? So how did you plan and how did you work with the IT team and the systems that we use at NAIT to really make sure that everything is captured? Like, especially thinking, we started at the scene in our immersive 360 space, then moved out into an ambulance, which, is not part of our typical repertoire, right? And then coming into a rural hospital that was set up, which is typically a classroom or lab space, and the tertiary hospital in CAMS, which has all of the built-in audiovisual components. What other considerations did you have to factor in?
Well, this kind of goes back to the first question of being involved in the steering committee in the first place. That enabled us to reach out to potential sponsors of the event to provide solutions that we needed to fill those gaps. So we know we wanted to capture what was going on in the rural hospital and in the hallways and in the ambulance. So we're able to reach out to partners early enough to provide those solutions.
Yeah. And so can you tell us a little bit of what some of those were?
Yeah. One of them was Intelligent Video Solutions, who kindly offered us a live streaming and video capture service for capturing those unique instances in the back of the ambulances, in the hallways, and in that rural hospital. Mm-hmm. Echo Healthcare provided us with some of the patient monitors that were vital throughout the hospital. We have some patient monitors, but we needed way more for the scope of this practical experience.
Mm-hmm. Absolutely. I just really wanted to highlight that because I think other sim centers might be thinking, well, we don't have all of that equipment for that many patients all at once, but there's a way to collaborate.
Always a way. If you start early enough, there's always a way.
Exactly. That's a great point. So thinking a little bit more broadly, I want to hear from you both about what do you most enjoy in your roles as sim technologists, especially working on experiences like this?
I think there's a lot of things that you could list, especially because the role isn't very defined. It's kind of you come in and every day it's going to be something different. I think I would go a little crazy if every day we had an MCI. So each day is a bit different. I like instances like this because it's really an opportunity to get creative with it. Coming from my background in body modification, I was more on the creative side. So moving more into a position like this, it's nice to get the opportunity to express that. Not requiring character backgrounds or careers in their actual character design is, a lot of people don't care about that part of it, but it can help flesh out those characters for the SPs, make them really get into the role more instead of just being character number 11 or character number 12. So I really like that we can integrate those personal aspects as well as even in the sim setup, like in the building collapse scene. It's nice to just kind of be able to make it messy and dirty, and it doesn't have to look the exact same each year.
Yeah. How about you, Tom?
I've been doing this for about 11 years now, and I definitely see a change from a SimTech being the person that kind of sets up the room and runs a mannequin to it being fleshed out as a full career and a profession. That change has happened over time, and it's taken a lot of intentional effort seeking out those opportunities to help other people out. And that's really kind of what we do in CAMS is we support the School of Health and Life Sciences in pretty much every avenue you could think of, from creating small videos. We were doing literally this morning, editing videos, creating virtual simulation content, supporting these huge things that are planned out years in advance, all the way to adapting and doing just-in-time simulation with a couple days notice. It's that flexibility to support the faculty in delivering those experiences to the learners. And we get to see the progression of those learners throughout the semester and seeing their confidence and skill set grow. It's awesome. I love it.
Definitely. And I think, especially at NAIT, depending on the program, the number of times they come to CAMS and get to facilitate is varied. Some programs more often than not, but still you're living it every single day. You get to see that broad perspective and experience across these programs and can bring that forward. So I know I really appreciate it as an IPE facilitator, and I'm sure the other programs would echo those comments.
Yeah, we get a really unique perspective, especially even seeing the groups that come in year to year. You can see slight differences in them, just personality-wise and everything like that, and you really get to know them if they're in frequently, and each time is an opportunity to enhance their learning.
So you touched on it a little bit, but I want to just close on where you see the role of the SimTech evolving in the future. It's already been some progression, but where do you think the next steps are?
There's so many avenues it could take, and I think it's very person dependent. I see the role of the SimTech as Sim is expanding at the rate that it's expanding, becoming more specific, and people gaining like specific designations within the bracket of sim technologist. So the kind of artsier side and some of the storytelling elements that Bree was talking about earlier, that's going to become a part of that profession. And they're going to need specialists in that area as we start venturing into sort of screen-based and virtual reality simulations. We're going to need game developers, storytellers, artists to create that content with us. And that's going to be part of a SimTech role one day as well. I can see SimTechs stepping into more of a research role. I can see SimTechs stepping into more leadership roles. I can see us advancing almost as learning architects more than how it has been in the past. So working collaboratively with facilitators to really hit the needs of the learners.
I love that. I agree.
Yeah, just kind of jumping on Tom's point. Maybe it's just where I see myself going more, but I think there's many different avenues you could go. But I think I can see SimTech stepping into more almost of an education role where you're able to speak to different industries about the benefits of simulation. I have friends who are in healthcare right now who didn't go to NAIT and don't have our simulation experience, and they're honestly amazed by what we do. And that's just the healthcare industry. So if we could branch out and share the benefits of sim with other industries, then I can see us being in that role.
Yeah, that's making huge marks at NAIT as well right now. It started with pilots back in the day, and flight simulators, moved to healthcare, and now we're having conversations with carpentry, with culinary arts, all over the place. People are interested in simulation and want to get involved.
I just think that it's our job to educate also on simulation best practice while that's happening. So just having a SimTech at the forefront to help guide that transition.
Yeah. Well, thank you both for joining me today. It's been wonderful hearing your perspectives. It's really nice to dig a little bit deeper into the side of the SimTech role. And I absolutely agree. It was instrumental in the delivery and the success of the Mass Casualty Incident, but every day within the CAMs for our sim. So thank you so much for being here and everything that you do.
Thanks for having us.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.